Hey there, everybody. Welcome back. Dr. Dan here at Iowa State University. And now we're going to talk about something that is near and dear to my heart, and that's starting high-risk calves. I have spent my career, 20-some years of practicing veterinary medicine for stocker operations, for grow yards, for backgrounders, for feedlots, and that weaning animals and understanding how to get cattle started is so important. And so we're going to talk more and more here about some of the things, a lot of things I didn't learn from a book. A lot of these things I just learned from trial and error, and heavy on the error part, but maybe explain some of the things that I look at or people look at when we talk about high-risk calves. So I'll get my screen up here, and we'll just talk about management of high-risk calves. I don't think we have truly valued the properly managed calf, both with our checkbook or with just our time and energy as human beings and for animal welfare. But probably the number one breach that we have in the industry for animal welfare is not properly managing cattle prior to them being shipped to the next change of address. These animals need to be preconditioned, they need to be castrated, they need to be dehorned, they need to be vaccinated, they need to know what a water tank is, they need to know what a feed bunk is, they need to know that people are not predators. All of these things relate to improved calf health when they get to the cattle feeder. And I hear people say, well, I won't get paid for it and things to that nature. And I'm just going to tell you right now that there are things, I'm not going to leave my kids a lot of money. So something that might cost me $1 or $2 or $4 a head, really is things that are practices of me leaving an inheritance or leaving a heritage to my family, so they might be able to be involved in the beef industry as well. So it's kind of paying it forward and doing it right so that we can leave it better for the next person that's going to come along and do it. But when we have a high mortality episode, the thing that we're going to do is we're going to come into the first question is, to me during a high mortality episode, is this a morbidity problem or is this a case fatality rate problem? And a morbidity problem means as we increase the morbidity, we will see an increase in mortality. I firmly believe that 10% of the cattle that are truly sick with bovine respiratory disease will die regardless of how we treat them or what we do. Case fatality rate, generally speaking, our case fatality rates in feedlots will run 5 to 10%. And when we are looking at case fatality rate, it is defined as the number of cattle treated that died divided by the total number of cattle treated. So if our case fatality rate is 5 to 10%, that means we're treating a few cattle more than are probably need to, but that means we're getting deep enough in the pen that we're trying to cover all the animals. We'll find out from Jason and different people, we're really not very good at finding sick cattle, but this is a good gauge. So to just give you an example of what I'm talking about is last year a producer had 1% death loss and this year 5%. We're going to change drugs or vets and we're not particular on which ones. And so when we look at these health events, the one thing producers are really good at keeping track of is mortality, but not so much on morbidity. And it's important to keep track of how many they're treating so that you can gauge whether or not they're having treatment success or a morbidity issue, or maybe treatments aren't working so good. But last year we pulled 10% of the population, and this year we pulled 50%, which means that our case fatality rate for both years is the same. This is truly a morbidity issue. And I can tell you 90% of the time for me, these high-risk calf and these high death loss issues are typically morbidity issues. So the drug worked the same, the people are working the same, our cattle management systems are working the same. The difference is maybe we bought a different sorts of calves, maybe we bought lighter calves, maybe we have different viral pathogens that are present, BVD, IBR, coronavirus, influenza, all these new things that we're learning. The weather patterns can be different. You put a cold 30-degree rain on the backs of high-risk calves, and it's no different than people. They get cold, they get chilled, they respond differently to viruses. They are immunosuppressed because of the stress of the situation. People are inconsistent. Maybe we don't have enough people. Maybe we have people that aren't trained properly. But Gary Gentry used to say the three most inconsistent things in the world are cattle, weather, and people. And this is something that we deal with every day in beef operations. Transportation, all these different things can lead to increased morbidity patterns, which then increase mortality. If I refer to a feedlot survey, it's the 23 feedlot consultants that we kind of baseline. They cover 17 million head of cattle, and we're just baselining what they're doing as far as standards of practice for newly received calves, whether it's vaccinations, metaphylaxis, things to that nature. But again, I just want you to know the source of that information. So let's start out with morbidity, or what causes morbidity. And the first thing I would say is cattle flow. As cattle come into a facility, what dictates cattle flow is the market. And so as cattle move off of grass and come into the sale barns, not only is it a price break, but it's availability. And as we start to think about filling up our yards or filling up our grow yards or filling up our stocker operations, cattle sometimes are only offered seasonally. And so if we don't get into the market, then that means we aren't going to have any cattle in our operation, which is economically crippling to a feedlot or to a backgrounder or whatever. Losing a little bit of money can be detrimental, but not having anything in the system and having employees and things of that nature. But we can overwhelm the system. So many times we'll sit there and say, well, this year we're only going to have this section of the yard or this section of the grow yard for high-risk calves, and until they move out, we're not going to replace them. Well, we that's all good and fine until the cattle start rolling in and we have people standing around with nothing to do because our facilities are empty. And so we decide that we're going to overwhelm the system, and we buy too many, and we fill all the pens up to where there's just tails hanging over the gates. And we need to understand that when we overwhelm our facilities or we overwhelm our people, that we're going to have things start to fall through the cracks. And the problems with high morbidity cattle or high risk cattle are exponential, not linear. And there's a point in time in which the system breaks and the people break. And we need to understand that cattle flow is what dictates the number of animals coming in. As in weight goes up, death loss goes down. As in weight goes up, morbidity goes down. And so as we increase the in weight of these animals, you'll see here, this is from millions of head of cattle, our death loss goes down. Once we get to about a 600-pound animal, we'll start to see the decrease in morbidity, the decrease in mortality, and we can project those cattle at 0.75 to 1.5% death loss. But as we go into these lighter weight groups, as the in weight goes down, you can see this curvilinear or exponential increase in morbidity and mortality occurs within our feed yards. Commingling is another big thing. If cattle aren't prepared, if they aren't vaccinated, if they're exposed to stress and new pathogens, there are two reasons why animals get sick: an overwhelming dose of a pathogen or a suppressed immune system. And when we commingle animals and abruptly wean them into sale barn operations, we're having a combination of overwhelming pathogens with suppressed immune system. When we started looking at back tags on cattle coming into our feed yards, it was not uncommon on a one-load pen, 100 head, to find cattle put together from 32 different sale barns in 5 states. And it isn't just the Southeast. Y'all have you just have massive amounts of grass and massive amounts of cattle operations. But we can flip this same system, a commingling system, into South Texas, into Kansas, into Iowa, into West River, South Dakota, Northern California. I was at Cactus. We had to buy 25,000 head of cattle a week. And so that was, we bought them wherever we could get them. And these systems are not specific to the Southeast. These systems are across the United States, where we're buying them 1 head, 2 head, 10 head at a time. And these animals are going to be commingled. So again, understanding why preconditioning, preparing these animals for exposure, send them to a sale barn, send them to an order buyer, to a feedlot, is like running them through airports and train stations and different things like that with people. And we don't have masks to put on these cattle. Now I'm getting old enough. Some of my pictures are starting to date me a little bit. You don't see a lot of these pictures anymore. But anyway, it is not uncommon to haul cattle over 8 hours. I mean, it used to be those were long haul cattle. Now anything within 8 hours, they're local. But when we start to think about trailers and climate, when we think about lightweight calves, cold is just chills those calves to the bone and can be crippling immunologically and stress wise to these calves. And with hauling fat cattle, it's heat that melts them. But the things that we have going on in these trailers, we have poor air circulation, which then again relates back to commingling and cattle breathing viral particles. We have metal tops that increases the heat stress within these smokestacks and diesel smoke. But you know, someday, somehow, I'm going to be a part of climate controlled trailers for long haul calves that are like airplanes that provide comfort and first class service when we transport these calves from one place to another. But transportation is a huge stress that decreases the immune system, and the longer we haul them underneath these circumstances, the higher the stress, the lower the immune system, and more problems when we get them. Adding on pens is defined as, let's say I have a 100 head pen and I got 80 head in the pen. Well, I need another 20 head to go on top of those 80. So the next group that comes in, I peel 20 off and I add them on to a pen. And I have problems with big producers, with small producers. I had one fellow from Ohio that called me. He says, you know, I have a problem. I have 50 head pens and I'm having trouble with BRD. And I said, well, how do you buy your calves? Well, I go to the sale barn and I buy, 15, 20 head at a time. So it takes me 3 to 4 weeks to fill a pen. And I said, well, we need to even probably decrease your pens, or we need to acclimate those cattle and commingle them after we get them started. But we have found through our research, it takes you longer than 7 days to finish or close a pen off, due to the social every time you add a calf to a pen, you change the social hierarchy. Every time you add a calf to a pen, you're changing the viral pathogen load or changing the stage of disease in which that pen is at. And so they're always behind or they're always ahead. And you can also bring cattle in after a diet change. And so as we start to think about this, if we can shut that pen off at 5 to 7 days, we're going to have better luck with the morbidity and mortality. Receiving pens, when calves come into the feed yard, the first thing they want to do is, after a long haul, is lay down. And if the pen floor is muddy or the pen floor is hot, the calves will stand there and not lay down and not get rest. It's no different than me or you driving, through our driving a long ways, and we get to the hotel. We want to kick our boots off and relax and stretch out. Sure, we want a cool drink of water or we want something to eat, but the first thing is, I just want to lay down. I just want to rest. Well, cattle aren't any different. And if we'll let them come in and we put some bedding down on hot days on those pen floors to cool those calves off, or if we put down something or some shade to keep the ultraviolet rays from absorbing into that dirt, you can lower that pen floor by 25 to 30 degrees, which makes a huge difference in those animals being able to be comfortable and lay down. In the same way with mud, provide some bedding. You can go in there with a box scraper and make one lap around a muddy pen and get that mud moved, and you'll be amazed that those cattle will be laying in that track where they don't have to lay down in that wet mud, and they can be comfortable. It's just amazing what we can do for cattle comfort, which is almost as important as the vaccines in which we give them. Speaking of vaccines, processing is not a timed event. We want clean equipment. We want sanitary equipment. We want clean chutes. We want clean floors, because if they're not clean, it means people don't care or people don't have time to get it done. And both of those are a problem. Processing is a quality event, not a quantity event. People say, well, when do you want to process? And my rule of thumb is, for every hour the calves are on the truck, I give them an hour to rest. So if these are cattle that were hauled for 24 hours, I'm going to give them a day to rest. If they were hauled for a couple hours, I'm going to probably process them off the truck. So it's basically give them time to rest, give them time to rehydrate, give them time to get some hay. But I'm not going to wait longer than that, because when I do know that when I wait longer than the 1 day or 2 days or 3 days and I wait a week to process, this delayed processing does nothing but get us to a point where when we have a BVD PI calf, that virus goes through those calves within just like wildfire. So I don't want to wait and do this delayed vaccination of 20 to 30 days, because I have seen absolutely wrecks due to BVD PIs within the herd, and we'll talk a little bit more about that. What are people vaccinating with? We vaccinate high-risk and low-risk calves with the 5-way modified live viral. The difference between high-risk and low-risk calves is using a Mannheimia vaccine. You can see here, 75% of veterinarians recommend a Mannheimia vaccine for high-risk calves. Nobody uses them on low-risk calves. The Clostridial vaccine, if you're going to ban calves, make sure you use a tetanus toxoid. And then the blackleg vaccine, I use blackleg vaccines on all cattle on arrival. I don't revaccinate with anything like blackleg. But if I don't know that the animals have been vaccinated for a 7-way Clostridial, or I know they haven't been, I'm dang sure going to do it, because I have seen 3 blackleg outbreaks in feedlots. But I have never seen a blackleg outbreak in a feed yard or a grow yard when a blackleg or Clostridial vaccine was used. Every time I've seen an outbreak was when the veterinarian recommended don't vaccinate for blackleg, and those wrecks were financially crippling, not only for the producer but also for the malpractice insurance of the veterinarian. So why not do this delayed vaccination? And we've heard a lot about it, but I can tell you my recommendation is we want to vaccinate those calves. We're going to give them a day to rest, but then I want to get them through the chute. And if I have high-risk calves and low-risk calves sitting there in my facility, I'm going to make sure the high-risk calves are vaccinated or processed closer to the time that I want them done than the low-risk calves. The low-risk calves are the ones I can put off because of BVD. 1% of the cattle are born persistently infected to BVD. Half of these calves die before weaning, meaning that 0.5% of the calves coming into a feedlot are going to be persistently infected with BVD, spewing BVD virus out of every orifice in their body. If 0.5% is the prevalence, that means 1 in 4 pens of 100 head pens is going to have a BVD, a persistently infected BVD PI in the pen. Once they're at the feedlot, half the BVDs die or are railed due to chronicity when they're at the feedlot, meaning 25% of BVD PIs go through our entire system from birth to slaughter, creating disease issues along the way. I think that we're going to do a lot more work of understanding which animals are carrying viruses and what those viruses mean throughout from the cow herd to the feedlot. And the new one that I should probably add on this is probably anaplasmosis, as we study this and understand transfer of disease from animal to animal and what that could mean for animals that are coming into the feed yard. But one of the things that I wanted to know, if 0.5% are coming in persistently infected, are they in concentrated areas within the yard? And we had a restart program, which basically all of our railers at Cactus went into one pen. And we found that in our calves that were railers or that were chronics, 3.5% of them were persistently infected with BVD, meaning that they were 10 times overrepresented in the chronically ill cattle than they were just on the cattle in the general population on arrival. We also looked at the same thing where we did an ear notch on all cattle that died at Wolf Creek Feed Yard for a year, 1,500 heads, And again, we found that 4% of dead cattle were persistently infected with BVD, meaning that they were 10 times more represented, BVD PIs were more represented, 10 times more in our dead cattle than in the general population on arrival, which makes some sense. So the last place you want a naive calf is to be in a hospital pen, right? Well, I started looking at why cowboys were pulling calves that were persistently infected BVD, because they didn't know which animals were infected with BVD or not. And what we found is that most of the time when people were pulling calves in a feedlot for coccidy that were persistently infected with BVD, they were being pulled for coccidiosis because of the bloody diarrhea. Doctors were then treating them for coccidiosis and salmonella, and when we necropsied them at dead, we called them abomasal ulcers, coccidiosis, or pin dead enteritis. Well, my coccidiosis treatment was 5 days in a row of amprolium drench. So here we are running these BVD PIs through the chute 5 days in a row, where they're putting saliva and they're being commingled with all the other calves that are in there for being sick, and then we send them back out to their home pens or their pastures, which probably isn't the best biosecurity in the world. I started looking in feed yards and pulling up, like on an 85,000 head yard, we only had 18 coccidiosis cases. Coccidiosis is not a problem in feedlots. We feed Rumensin, we feed Decox, different things to that nature, and it controls it very, very well. They're not on grass, they're not recycling. And so when I looked at here's a pen of calves where we pulled 2 calves for coccidiosis, and they were yearlings that we projected a 0.5% death loss, and here they are at 2.5% death loss. Here's a pen of high-risk calves that we thought we'd have 2.5% deaths. We had 10% deaths. And so as we start to see coccidiosis in these backgrounder or operations, dry lot operations, one begs to think about, is this truly a coccidiosis, or are we not getting the right diagnosis? This is a 2-year-old bull that they pulled and treated for coccidiosis for 2 weeks. Before they brought him to us, it was persistently infected with type 2 BVD. What does type 2 BVD infections, transient infections, do to the immune system? It is crippling. That's the reason why you have to vaccinate them right off the truck. These animals were vaccinated, and 28 days later, they challenged them at day 28 with type 2 BVD. You can see that the animals that were vaccinated, their white blood cells stayed at a high level with the yellow line. But the animals that were not vaccinated, that were the controls, you can see that when they were challenged with type 2 BVD, their white blood cells went to nothing. They had no immune system to fight off the pathogens in that we're nature. So when we start to think about this, how soon can they become viremic? These animals, within 4 days, 100% of the non-vaccinates that were challenged with type 2 BVD were viremic, and they stay viremic for 2 to 3 weeks, so 14 to 21 days. But the ones that were vaccinated, they were able to not get the disease, not get the viral viremia, and therefore have a better immune system. Again, we get into a lot of these discussions on, should I ear notch and test and remove? I don't know that that's such a necessarily a great option, except that if you are going to test and remove, you need to do every animal that comes on your premise, because the one pen you decide not to do, it'll be the one that has 10 BVD PIs. So my recommendation is, the lighter the cattle, the better the opportunity is to, and the more high likelihood I would recommend that we test and remove for BVD PIs. High risk cattle obviously will have higher probability because people don't have vaccination protocols in their cow herds and things to that nature. If you're going to BVD ear notch, you need to do it with every animal on the premise. You can't do it with just one or two, or just hunt and peck on the pens, because those animals all need to be done all in, all out. All animals are tested for BVD PIs. But at the end of the day, test and remove works. But the number one thing you need to do for bovine viral diarrhea is vaccinate. And vaccinate the cows. We need to vaccinate the calf crop, and we need to vaccinate it at weaning and arrival at the feed yard to control for BVD. We can vaccinate ourselves out of persistently infected status, but these are things that we have to do. As far as controlling bovine respiratory disease, the number one way to control bovine respiratory disease post-arrival, besides vaccination of viral pathogens, is metaphylaxis and mass treatment of antibiotic on arrival. In study after study after study, the 30, 50 studies, the metaphylaxis, the meta-analysis study that Ben Wildman and I published, if you use metaphylaxis on arrival, you will decrease morbidity by 50%. So if I'm expecting 50% morbidity and I mass treat off the truck with an antibiotic, I will have 25% morbidity. If I'm expecting 30% morbidity, I'll have 15%. If I'm expecting 20%, I'll have 10. It works like clockwork every time. Metaphylaxis is our number one tool for controlling bovine respiratory disease in high-risk calves coming off the truck, bar none. Metaphylaxis is to controlling high-risk or controlling bovine respiratory disease as implants are to improving feed efficiency and natural resource utilization. When we ask people to use metaphylaxis, 100% of the people use metaphylaxis on high-risk calves, and very few use them on low-risk calves. When we get into the low-risk calf group, using feed-grade antibiotics tends to increase. It's cheaper. I can tell you that feeding CTC at 10 mg per pound is highly effective in decreasing morbidity in high-risk calves and in medium-risk calves. I like using the CTC in combination with a parental antibiotic, and I will feed it 5 days on, take a day off, and then feed another round of 5 days on those high-risk calves. But the one thing the one time I don't use CTC or Oreo in the feed is if I'm going to use oxytetracycline as my parental metaphylaxis drug. I have done enough studies to know that when I do that, I will get no advantage of feeding CTC. But regardless of that, the other macrolide compounds and fluorophenocal, those types of compounds using CTC in combination can have an additive response to response. Acclimation is huge. Until proven differently, you are a predator to an animal. Until proven differently, you are a predator to a steer. And as we have this undomestication of our cow herd where people don't spend time with their cattle, we have big bales on the backs of flatbed pickups, and we get out just long enough to uncut the bale wrap and unroll the bale, and the cattle don't see the people. Or when we come up and we have these fancy mixer wagons and we have these fence line feed bunks, we have the point in time where we're coming up and we're in the cab of our tractor and we unload the feed in the feed bunk, and the cattle don't know that there's a human driving that tractor. And now when we doctor a calf out on the pasture, we don't go out and get it and move it up to the barn or interact with it. We drive up, roll down the window, stick the dart gun out the window and shoot it. Cattle are starting to understand that if you pull in with a flatbed pickup and there's no bail, someone's getting shot for foot rot or pink eye or whatever. And I get it. I understand the ease and the safety and the welfare and how all this relates. I'm not against the technology, but when people don't spend time with their animals, the animals don't know that you're not a predator and they don't know that you're a caregiver. And until animals trust you, the last thing that an animal wants to do to a predator is show weakness, because then you are preyed upon. So if we want to spend time with our cattle and doing exercises and acclimating them, all it does is it helps improve the ability of cattle to trust you. Cattle will show you clinical signs of disease sooner, and then we have earlier treatments. And whether it's foot rot or BRD, the sooner we intervene, the better the response we have to our treatments. So acclimating, using hay is important, okay? We want cattle eating 1.5% of their body weight by a week and a half on feed. if cattle aren't consuming 1.5% of body weight of feed by a week and a half on feed, we know that a wreck is coming. This hay processor and putting out hay is your best friend. The one thing that the first 4 or 5 days, and we'll talk more about this receiving calf nutrition, but feeding calves hay and getting their bellies full is something that is familiar to them is just huge. This is when I pull up to a feed yard and the hay's out, and these are calves that haven't been processed yet, and I see them eating like this. I have a pretty good idea that our vaccines are going to work, that these cattle are going to have a belly full, they're going to have energy, they're going to have water, all of the things that are going to be important for us to have that immune response and decrease sickness. If I'm going to top dress my ration, I'll put my one ration like I do right here, and we're going to talk more about receiving calf nutrition here in a minute. Pen size. Again, the lower the pen size, the better health. And so the optimum size pen is a 100 head pen. I don't have to commingle cattle. I get a truckload in, I process them, I put it in a pen. Bunk space. When people ask me, well, how much bunk space do cattle need? I want all the cattle, high-risk cattle, to be able to get to the bunk at once. If they can't get to the bunk at once, all of them, and I have cattle 2 deep or 3 deep at the bunk, I don't have enough bunk space. And the passive cattle are the ones that won't eat. They'll have nutritional stress, and we'll wind up having BRD outbreaks. So small pens, lots of bunk space, really important. When we ask people to rank the things for morbidity or things important for predicting morbidity and mortality, number 1 every year is cattle health risk. 2, 3, and 4 are mixed up, but labor, nutrition, and weather patterns, and the things that we argue about the most, the class of antibiotic for treatment, the class of antibiotic for metaphylaxis, or the brand of vaccine, they were the lowest of all of them when we ask feedlot veterinarians and feedlot managers. Getting good cattle, having good people, good nutrition, and watching that weather, which we can't control, are the most important things. Use an antibiotic, use a vaccine. They're all good, but don't look at management in the bottle, because the silver bullet does not exist. So we'll talk a little bit about case fatality rate. And case fatality rate is we stink at finding sick cattle. We've done studies where we've looked at cattle at slaughter that had no lung lesion, moderate lung lesion, or severe lung lesion. And what I can tell you is in study after study, we just can't find sick cattle in the pen because they're so good at hiding clinical signs. In this study, we pulled 26% of the cattle, which means 74% were never pulled. Of the 74% of the cattle that we didn't pull for respiratory disease, 43% of them had lung lesions at slaughter, and a third of them had lung lesions so severe that they were adhered to the rib cage, so that when we pulled the pluck out, we had the trachea, the heart, and some remnants of lungs, and we can't find them. It's just something we have to work on. We need better technology. Yet one of the things is we ask people, how many people do I need? And one of the things that came away from this is high-risk cattle versus low-risk cattle. The high-risk cattle require twice as many people to take care of them as low-risk cattle, whether it's pen riders, doctors, processors, anything. And one pen rider can take care of about 3,000 head of high-risk calves. And that's in an enclosed system, that's in an organized system, pen to pen to pen to pen. On pastures, it's even more difficult. How many times a day should you ride sick cattle or high-risk cattle? Most people want you to do it twice. I'm of the belief, go through them once thoroughly, because I don't know that I can get done before the heat of the day. When you ride cattle twice, you need to ride them early in the morning, get through all the cattle, then come back and go through them again. But you get to that 2, 3 o'clock in the afternoon and it gets hot, all the cattle look sick. They're starting to succumb to some heat stress. I just think that riding through the cattle once, but again, most people are recommending going through those cattle twice. Some of the questions I get on antibiotics and treatment and case fatality rate, should I use one antibiotic or combination of antimicrobials? I can tell you that none of the antibiotics that we have today are labeled to be used in combination. And when we start to think about bactericidal and bacteriostatic antibiotics, what we've learned in human medicine when we mix these classes up is that they can negate each other. And it can actually be more harmful to use two antibiotics at once rather than just using one good antibiotic. How long should I wait to treat again? That's dependent on the antibiotic that you're using. You have a 7-day moratorium or a 48-hour moratorium. What I have found from looking at millions of cattle records, on average, the days from when I treat the animal for bovine respiratory disease until to retreatment, one coming in for a second treatment, is usually 11 to 14 days post first treatment. Meaning that regardless of the moratorium, it doesn't matter. I'm going to retreat at 11 to 14 days, whether it's a 10-day or 2-day moratorium. So use an antibiotic and consistently monitor the health of these animals. How long should I? But the one thing to know is that if I have a 7-day antibiotic, I have antibiotic on board for a week. Therefore, coming in at 5 days or 3 days, if I have a calf that I treat day 1, day 3, day 5, I don't buy a big bag of feed for that animal because that animal is not responding and it is losing ground and is fighting its war against that disease. When should you switch to the next drug? And again, this is a great question. I don't have the answer to it. We use one class of antibiotics for our first treatment, another class of antibiotics for our second, and another class for our third, because we assume that we've picked the wrong class of antibiotic when I can tell you that I've had feed yards that can't keep the treatment straight. So I just said, we're going to one treatment. Meaning if they get pulled the first time, they get drug X. If they get pulled the second time, they get drug X. If they get pulled the third time, a fourth time, it doesn't matter. We're only using drug X because we can't keep our regimen straight. And I can tell you my case fatality rate did not change. So sometimes I think we outsmart ourselves. But if I use drugs from different companies, I get to go from 3 different companies, I get to go on 3 different fishing trips. So that helps. That's just to see if y'all are still awake and listening to this. The route of delivery, you'll have people say, well, it says sub-Q, but I IV'd it to get it to the infection quicker. I can just tell you study after study after study, our drugs, you're talking about a difference of like 40 minutes of an antibiotic getting to the lesion quicker from IV versus sub-Q. There's no reason to do it. And actually it's extra label drug use if you do it that way. Should I use multiple day low doses or one dose large? And this is like with Nuflor or Baytril or one of those where you can use a high dose once. And if it's a concentration dependent drug, there's no reason in God's green earth to do a lower dose 3 days in a row because duration doesn't matter, concentration does. And I can tell you from experience, doing the higher dose once versus running the calf through the chute 3 days in a row, you will double your case fatality rate. So use the high dose, use that 6 cc's in Nuflor once versus 3 cc's 3 days in a row. And if I gave you the same, if you go to the doctor and he says, well, I got 2 treatment regimens, I can give you the big dose once, and then I don't need to see you again, or I've got a lower dose that I need you to come into my office and get 3 shots 3 days in a row. And oh, by the way, there's twice the likelihood you're going to die with using this lower regimen. Which one would you pick? The wear and tear on the cattle, the wear and tear in your facilities. Let the drugs work the way that we had designed them and that they do. So what is normal antibiotic success? We will have 80% success with one treatment, meaning 20% of the animals we treat with bovine for respiratory disease will come back for a retreat. They come back 11 to 14 days post first treatment. After that, we will have a 50% success rate of the second treatment, meaning that about 10% of them are going to come back for a third. And of those that get a third treatment, half of those animals are going to die or be chronically ill. So once you treat an animal 3 times for bovine respiratory disease, it's a coin flip on whether or not that animal is going to be a success or whether it's going to die or need to be railed. Those are just some of the things that we do. What about ancillary therapy? I have yet to see an ancillary therapy that makes a difference in treatment outcome that I can measure in the field. So we really focus on the antibiotics. But I know a lot of people use ancillary therapy, and but again, I just haven't seen the studies to support it. I'd be pleasantly surprised if someone can prove me wrong. What is more important are our hospital pens. The hospital pens are the most abused pen in a feed yard. We don't give cattle enough space. We should give cattle at least as much space and as much shade as they're going to get in their feeding pen. We should have fresh water. We should have fresh feed. They should have places to lay down. These should be the most comfortable. These are our intensive care units. Yet we put them in these little bitty corners in these areas with poor airflow, with poor pen conditions, and we wonder why our treatments don't work. This is of essence. Clean equipment, comfortable pens, spacious pens, fresh water, shade. We need to treat these animals as if they are the most precious things on the earth when they're sick. This types of stuff, people ask me, well, I've given this one 2 doses of mericomycin and hadn't done anything. I believe you. The water tanks that aren't clean, not providing shade. There's a bowling gun. They got into a huge wreck in a feed yard in Washington State because of salmonellosis, because they never changed the water in their bowling gun bucket. And then every time they gave a calf something with the bowling gun, the animals got salmonella that came to the hospital. So at the end of the day, we give these animals all this medicine and they still die. And what I really want to get to is this fatal disease onset, treatment to death interval, and days of feed. And fatal disease onset is the day in which we first treat a calf that eventually dies. Treatment to death interval is the number of days between when we first start treating one and when one dies. And then days of death in the feed yard is when how many days on feed when the animal dies. This is a study done by Fulton at Oklahoma State. We repeated it at K-State. But on average, fatal disease onset is 30 days. So if you pull cattle within the first 2 weeks for BRD, you bought the problem. If we're going to have something due to a feed glitch, it's usually around 21 to 28 days, and acidosis is the issue, decreasing the immune system, causing a spurt in BRD outbreak. But on ranch fresh calves, our fatal disease onset or our peak morbidity is 28 to 42 days on feed. Now, treatment to death interval is 30 days. So when I start treating cattle, it is a month later before I start seeing the increase in death loss. So when we start to talk about this and we get together in the summer and we're going to treat this in change this in our processing program, and we start buying these high-risk calves, and we don't see a big spike in morbidity, and all of a sudden we see this spike in morbidity, but we say, hey, all of them that we're treating are responding, none of them are dying. It's just we haven't waited long enough. You wait 30 days after you have your morbidity peak is when you're going to see your mortality episode, meaning that 45 to 60 days on feed is when we have halftime for bovine respiratory disease death loss. When we get out there to 40 to 60 days on feed, and we've been buying these cattle 45 or 60 days, and all of a sudden we say this death loss is too much, I want these deaths to shut off. If you've been buying them for 45 or 60 days, you have another 45 to 60 days of death loss coming, because all the other groups are going to continue to go through the same thing and throughout that feeding period. So when you get out there 45 to 60 days and you have 2% deads in a pen, you're going to wind up with 4%. If you're at 3%, you're going to have 6%. If you're at 1%, you're going to have 2%. And if you've been buying them for 45 or 60 days, you have another 45 or 60 days of death losses is going to happen. And these are just some things that you can be proactive to talk to your clients and things to that nature. Well, I hope you enjoyed this. We'll get to some questions here after a bit. Thanks for watching. I'm Dr. Dan.